for joining us. This is Jital Patel from Coastal Occupational Therapy. And on today's episode of Ask the Experts, we are here today with Emanuela Biban. She is the Medical Science Liaison at ClinCloud. And Dr. Biban, can you please introduce yourself?
Hi, Jital. Of course, my name is Emanuela Biban. I had received my medical degree from the University of Medicine and Pharmacy Craiova in Romania in 2009. 2011, I became the medical director to a private clinic and began to teach cardiology and nephrology courses in my hometown as well. I had been co-authoring in 2 medical books dedicated to the students and publish multiple clinical research materials during my career. In 2020, after COVID hit, I decided to dedicate my entire career to clinical trials, and I became a clinical research associate certified in United States with Clinical Research Institute, Houston, Texas, where I completed my internship. In 2021, I joined ClinCloud clinical trial team, and here I am, trying to advance the current healthcare model and treatment availability for today's incurable conditions.
That's an impressive and extensive background, and we're really glad to have you here today.
Thank you.
Of course, thank you. And so today we're going to be talking about health and wellness, specifically our brain, our aging brain, and we're going to tie that into about how that affects our driving as we age. So to start off with, Dr. Biban, can you explain in a broad overview some major impacts of aging on the brain?
Of course, I will be happy to do that for you, Jital. So I want everybody to understand a little bit what happens with our brain since we born, because it's very important for us to understand the physiology and physiopathology of different kinds of conditions. So in the early years of life, the brain forms more than 1 million new neural connections every second. By the age of 6, the size of the brain increases to about 90% of its volume in adulthood. Then in our 30s and 40s, the brain starts to shrink, with the shrinkage rate increasing even more by the age of 60. Like wrinkles and gray hair that start to appear later in life, the brain appearance starts to change too. And our cognitive abilities will alter in time. As people age, the bodily systems, including the brain, gradually decline. Slips of mind are associated with getting older, but what we need to watch for is the common memory changes that are associated with the normal aging process. So talking about that, we need to watch for difficulty learning something new. Committing new information to memory can take longer than usual, or longer than we used to be knowing. Multitasking, slow processing can make planning parallel tasks more difficult for us. Recalling names and numbers, strategic memory, which helps with remembering names and numbers, suffers and begins to decline actually at age 20. Wow. Remembering, yes, is very interesting, right? Remembering appointments. Without cues to recall the information, the brain may put appointments into storage and not access them unless something jogs the person's memory. So, all of these changes happen as we get older. Of course, this makes us anxious about memory slips due to link between impaired memory and Alzheimer's disease. However, It is important to know or remember the fact that Alzheimer's disease and other dementias are progressive diseases that some people get and are not part of the normal aging process. And because of that, we need to make sure we follow up with the right specialist and make the differential between two of them.
Right. That's very interesting. You say that how the changes happen at such an early age and we don't really think about that.
People realize, yeah.
Yeah, and what we need to do ahead of time to be able to, just like we exercise our arms and legs and work on our balance,
That's right.
working on our cognition as well. Very interesting. So,
That's
Dr. Biban, can you also go ahead and let us know about some of the impacts or that it impair our ability to ambulate and to drive, our cognitive changes?
So, yes, I can do that. Regarding driving, driving is both physical and cognitive skill, right? Unfortunately, approximately 1 in 3 older drivers may develop a condition called mild cognitive impairment, which can be an early stage of dementia. Because dementia conditions like Alzheimer's disease impact cognition and get progressively worse, the risk of impaired driving increase as the disease becomes more severe. And now probably you will wonder what part of the brain controls driving ability, right? Or maybe our patients are wondering what part of the brain control driving ability. Where are two parts of the brain actually? And the first one and the biggest one is the frontal lobe of the brain that is responsible for the driver functions, but not just for the driver functions. So the frontal lobe of the brain is responsible for motor skills as well, judgment, and emotional maturity. As we drive, it controls multitasking, making quick analyses and decisions, and keeping calm in stressful situations. While brain volume decreases overall with aging, the frontal lobe and the hippocampus, that are the specific areas of the brain responsible for cognitive functions, shrink more than other areas. The frontal lobes are located directly behind the forehead, right here. Mm-hmm. They are the largest lobes in human brain and are considered to be the human behavior and emotional control centers for our personality. Very interesting, right?
Very. And you know, driving is such a complex multitask activity, and
That's
knowing
right.
all the different senses that are involved and any changes in one of those, you know, we just have to think about how that causes our safety and our ability to drive.
That's correct. Wow. Also, in another hand, the hippocampus, that is a complex brain structure embedded deep into our temporal lobes. It plays a major role in learning and memory. That is also very important for our driver skills. Right. When we drive, it keeps track of the pedestrian we just notice heading our way and the cars in the left lane, what we need to keep track of, right?
Right. Yeah, so, and you know, we see that, right? I mean, how many times are we out on the road driving every day and we see things like that happen where the judgment, that quick ability to make that decision, it's not there, where, you know, there's a pedestrian crossing or you're on a green or a yellow light, and what to do in that instance, and being able to notice that, you know, there's a car coming and you're in that left lane. We need to be able to keep track of all of those different environmental.
That's correct. That's correct. And once we have an impairment in that area, we are in danger and we put other persons in danger. So we need to be aware if we have a cognitive problem. Also, multiple studies have shown that the hippocampus is susceptible in Alzheimer's disease. And the patient has difficulty making good short-term memories. So that's dangerous as well. For this, many times when the patient is coming in our office, we make sure they are able to drive themselves.
Mm-hmm.
If they have like an early stage, but if they have a moderate to severe stage, they will be not able to drive anymore. So we need to make sure they are safe. Them
Right.
safety and our safety is the best. And you guys help a lot with all the tools that occupational therapy right now has in them hands. This patient can benefit
Right.
from.
Yeah, and we'll get onto that topic in just a bit. And because as far as with occupational therapist and being driving rehab professional, that's something that we do within our scope of practice. It is so important to kind of have this talk early on, especially in the early stages. When someone does get diagnosed with mild cognitive impairment, that's the time to start having these talks because the disease is going to progress, and as it progresses, driving is going to get riskier and more unsafe. So understanding what's happening with our brains, the changes that are happening and how they impact our driving. If we have us as healthcare practitioners, caregivers, friends and family members, if we understand what's happening, I think that gives us a good motivation to have these talks with our concerned drivers, right? Our concerned parents that are
That's
aging and
correct.
driving.
Yeah.
Yeah, I know. So you are a medical science liaison and with ClinCloud, and you are working on clinical trials. What does
Mhm.
that mean? What do the trials offer? And with the clinical trials, how do they help prevent the progression? In these cases.
So it's a step-by-step process. The good part about clinical trials is the fact that give us the possibility to free consultation for all our patients. So what ClinCloud is offering to our community down there is free consultation to diagnose cognitive impairment or to early diagnose an Alzheimer's disease.
Trials. If someone was interested in participating in a clinical trial or finding out more, or if they qualify, how do they go about becoming a part of that?
Everybody is very welcome to contact us to ClinCloud Clinical Trials. Our site is located in Viera at Spyglass 7000, Suite 130. We will be happy to see everybody. It's going to be a step-by-step process. They need to come and see us for a pre-screen exam and see if they have a real problem or not. And once the pre-screen is done, we can say if they will match a clinical trial, and from there we will start the evaluation, the screening. Will be done a lot of investigation during the screening process. They will have MRI, PET scan evaluation, safety labs, ECGs, neurological exam and physical exam that is going to be done by our principal investigator, Dr. Rosemary Lair, that is amazing. And if the patient will qualify for this kind of medication, is going to randomize and we will start the treatment.
Okay. Perfect. So we'll put out your information as well. So if people are interested in getting, in contact with you, just getting more information, they definitely can. And what I want to also go back, I know from the beginning when we started talking about the impacts of, changes on our brain and impact on that on driving with occupational therapy. And I do want to plug in that, there's a lot of clients that we see, and that's one of the first things that we would ask. Well, how did you get to our clinic? How did you get here? How are you getting to doctor's appointments? When that's one of the first things we want to find out, because if there are cognitive changes happening, we want to know that, well, should they be driving or what's happening? And once there is a diagnosis of dementia, the question's not if a person should stop driving, but it's rather when, right? And so we know, yeah, and because we know dementia affects the cognitive functions that are so critical to driving, right? We need our judgment, reaction time, problem solving abilities, and changes in our physical and sensory problems also that kind of increase our driving risk.
That's correct.
Right. People, and I've seen this firsthand, with the clients that I've had, that those suffering from dementia, they often can't assess their own driving capabilities, and they can't, and the changes and make changes due to that. So what we want as healthcare providers, practitioners, friends, family members, we want to be looking out for those early warning signs that you did mention earlier, right? So if someone
Yes.
getting lost in familiar places, if they're having trouble making turns, trouble remembering where they're going,
Yes.
right? If they're drive drifting in and out of a lane, or any other difficulties that you find that's happening at that time, these signs indicate that a specialist needs to get involved, and a driving rehab specialist to be specific. There's
Yes.
someone that can do an evaluation, and a thorough evaluation, like you mentioned, that you have to do for a clinical trial. It would be the same idea, that there's a thorough evaluation done by the driving rehab specialist, that, we do a lot of cognitive testing, arm strength, leg strength, your reaction time, your vision, all of that to kind of indicate whether you're fit to drive, like a fitness to drive
Yes.
evaluation. And the evaluation gives a good starting point for measuring your safe driving capability. So, because we know that as the disease progresses, the driving is going to become unsafe. So it's a talk about rather when we should cease the driving, and think about other transportation plans, and rather that, when it's going to
Yes.
occur. Yeah.
I agree with you. Yes, very hard for the patient to accept the moment when they can not drive anymore, and that affects them a lot. Many of them develop depression because of that, and you will always hear during the visit saying, my wife sold my car.
Yeah.
That's so sad. I loved my car. Now, how I said, I feel like prevention is the way, because don't forget the fact that we have tools in our days, and we can prevent the progression.
Right.
And if they come in an early stage, they can keep the driver license, and with your help and the tools that occupational therapy are giving to them, they can keep the driver license for long term. Thinking about, we live in Florida and we are dependent of car. I cannot imagine how it will be to function without a car. Driving is the most important skill to
Absolutely.
have in this state. So is a big concern for us as well, because, for example, for the patients that they are moderate to severe, because we know dementia has different kinds of stages. And it's important too to find out what kind of dementia these patients have, because if you have Alzheimer's disease and that disease install to a young age, we will be smart to test you for an APOE that is going to tell us the risk of progression, because they are looking at the genotypes.
Mm-hmm.
And the patients actually that are coming through clinical trials, they have the opportunity to get in touch with a genetic counselor that is going to explain to them what does mean that result, what that genotype predicts. And that's great. And once you know you have the risk, there is the moment where we can intervene, me, you, and everybody that is involved in patient care, from the primary care physicians, specialist doctors like cardiologists to control high blood pressure, endocrinology that is controlling them diabetes, and is a team working for you to support you to do the best that you can and to have the great prognostic in the end. Unfortunately, how we know, we are seeing people with moderate dementia that are coming too late, and it's breaking my heart not be able to help. And I'm sure it's broken your heart as well. But I think you guys do a fabulous job for our country.
Well, thank you. And like you nailed it. Um, People do realize the symptoms a little bit later, the risks a little bit later, and it's at that point where unfortunately we're having those talks, well, where I think we should give up driving, but like you said, if there is a process available, there is a resource available for
Yeah.
people to take advantage of and find out what's happening and when it's happening so we can intervene ahead of time instead of waiting till it's a little too late for not just him.
That's correct.
Right.
That's correct. And I think working hand in hand, we can do better for our community out there, because all of us, we have grandparents, all of us, we have parents that need us. And how I like to say to ClinCloud, we treat our patients like family, and we believe helping one person, we can change the world. Because if this drug will help at least 10 people, we do better for 10 people.
Of course.
Instead of 0. And if you guys can help 10 people to improve their abilities, we will make a better world.
Absolutely.
And that's the goal.
That is the goal. And keeping people healthy and safe, I think that's the goal for all. And with the trials and research and drugs that you mentioned, I think that's great work that you're doing. And thank you for sharing all your information. I do want to mention to everyone, if you are interested, or if you have anyone that may benefit from a clinical trial like this, or if you just want information, feel free to reach out to Dr. Biban and her team at ClinCloud. And same for driving evaluation. If there is a friend or a family member, your parents or a loved one that you are concerned about their driving, we can do a simple consultation followed by an evaluation if that's appropriate. We want to take care of, we're not here to take anyone's licenses away. That's not what we're trying to do. We're trying to assess the ability behind the car, and make sure that you're going to be safe, or that you are safe to stay behind the car and continue driving as long as you can, as long as it's safe for you. So any questions, with Dr. Biban, feel free to reach out to her. And for Coastal Occupational Therapy, if you have any questions, reach out to us and we will help you out as best we can. Thank you for joining us today, Dr. Biban.
Thank you for having me, Jital. It was a pleasure like always.
Thank you.